So the whole idea broadly is all about personalization, customization, simplification of family planning information, make it more relatable to the youth, make it fun. Our AI system is able to understand those slangs, those ideological and sociological variations in our linguistic communication, and able to provide right answers to them. So we work with thousands of students across universities, both formal and informal youth, to collect all the terminologies they use. So when young people are talking about condom, there are over 15 languages used. Combo, for example, terminologies that they can say to your presence and you don't know what they're talking about.
I feel like that deserves a round of applause. Everyone, and welcome to another episode of the Break It Down podcast, where we simplify complex health policy and public health issues so we can all better understand the systems that shape our lives. I am Asarindem, your co-host. Unfortunately, today Chibike, who is the other co-host of the podcast, he's not around. Unavoidably, he is absent. I would like to use this to just make sure that everybody realizes that Asari is truly the mayor of Break It Down Town. I will never leave them hanging. Anyway, today we are exploring youth access to sexual and reproductive health information through the lens of digital innovation. And today I am joined by a very special guest. Please introduce yourself.
Thank you very much. My name is Dr. Olubayo Adekanmbi, the CEO and co-founder of Data Science Nigeria. And I work in the intersection of AI, artificial intelligence, data science, and digital innovation for social good. And finding ways to make technology work for everyday people around various verticals and of importance in the area of health.
Thank you so much. Yeah. So our conversation today is going to be a little bit different from how the regular Break It Down podcast sounds like, right? We're going to do a series of rapid fire questions, and I want you to be as explanatory or as succinct as you possibly can. Are you ready?
Where to go?
Can you tell me the name of the most popular products you have developed?
Wow, I think the most popular product would be in terms of reach, would be a product called Learn at Home, which was an AI-powered learning platform that uses SMS to deliver learning to billions of learners. And that was used by over 8 million people. It was built on what we call adaptive AI learning engine that simplifies learning via SMS.
I'm going to ask you to break it down.
Yeah, for students without internet and students without smartphones, so that they can learn even though they have no smartphone. Now, of course, the product went on to win UNESCO Top 100 AI products in 2021.
Love that. Okay, so what was the key motivation behind developing your platform, Honey and Banana?
Okay. Honey and Banana program is a broad large-scale program funded by Gates Foundation and managed by 3 partners, DKT, Tulane University in New Orleans in the US, and our organization Data Science Nigeria. It's all about promoting contraceptive continuity and bringing information on family planning, particularly to young people, make it more accessible. And there are a lot of diverse channels that have been created. There's a website, there is a call center, and there are programmatic events. But we felt that there was a need to create a more personal, interactive platform that's more like your platform, where you can ask any question at any time as well. And you can ask in your language, in your style, and all of that. So we saw the need to create an AI platform that leverages the capability of a chatbot to deliver personalized information in a very interactive manner. And of course, in a manner that is also standardized. Because when you go for family planning counseling, there are standard methodology, that it must follow. So how can we create a chatbot that follows those standard pathways whilst also being very personal, intuitive, emotional, connecting, and yet delivering on those fundamentals that can drive for behavioral change when it comes to family planning. So the whole idea broadly is all about personalization, customization, simplification of family planning information, make it more relatable to the youth, make it fun. Since majority of them already use WhatsApp, why not use that kind of platform to get them to get all the information they need? And this is not just getting information in form of text alone. They also get information in form of videos, in form of audios, giving them explanation on all that they need to know about family planning and all about their sexual and reproductive health behavior optimization.
I want you to walk us through the Honey and Banana platform.
Yeah.
Right.
So essentially, on your Telegram or your WhatsApp, you will just, join it like a friend. You add the number as if it's your friend. The same way I will add anybody's number. Yeah, on WhatsApp. So you just add the number. And as soon as you add the number, conversation will start. You just start, hello, and then it replies. And then it now runs you through structured KYC. KYC means, can I know you more? So that we also want to be sure that it's not underage children who are also using the platform as well. We also want to get accountable that you must meet certain age threshold before you can use the platform. And then the engagement, just freestyle as if you are using chatbot. Although you are using WhatsApp, which is it's just normal conversation that people are familiar with. And then you get to know the answers that you need. And if you're asking for a video, if it has the video, it produces you the video, and it asks you to click and watch. And it also asks that, are you worried about data? If you don't want to watch, you can read rather than watch. So all those possibilities are all embedded to make the experience seamless, simple, and user-friendly.
Love that. So my next question is, who currently uses the platform? And what does your user base look like?
The users, they are largely young people, both formal and informal youth. And that is why it's available not just in English language, it's also available in two Nigerian languages, spoken by over 100 million people. That's Hausa language and Yoruba language. Igbo is also in the pipeline, and Pidgin as well. And then we also have a lot of women as well, of sexually active women as well, who are also using the platform to engage, to ask questions and all of that. What makes the platform also very unique, which I also need to mention, is the fact that whilst it's a very personal platform, it's also able to link you to the nearest clinic. For example, if you're asking a question that the chatbot feels that it requires an expert guidance, then it can refer you to the closest health center, where you can then take that information closer. So broadly, our user base are young people, formal and informal, and women of reproductive age as well.
So how do you track who uses the platform? So what metrics do you currently track?
I think the most important, there are two things to say there. Number one, we know who comes on the platform, because based on the standard family planning counseling protocols, you must understand your audience, like a KYC. When they come to the platform, it must know who you are, so that the engagement is personalized to your context, to your age, so that, we also understand, why do you need family planning information? Is it just to prevent pregnancy? Is it to manage some other sexual and reproductive health related issues? So you have to provide your age range, your gender, and then you need to also provide why are you asking questions? Is it just general information, or is it about preventive pregnancy and all of that? So those information allows the AI algorithm to personalize the experience, asking the right question and guiding you. And then in the back end, we have analytical system that is able to say, where are people calling from, where are people engaging from, and then we're also able to know things like completion rate, what are the dominant questions people are asking. Perhaps, there are certain questions people don't ask or ask, and all those kind of things. So we're able to measure those things. So we can measure completion rate, engagement rate, closure rate, or even referral rate, which is the last one I mentioned. People will ask very complex questions that require follow-up engagement with an expert, who will then be referred. Of course, this is based on their permission as well, that will you mind referring you to call center or referring you to the nearest health service center, so that you can progress that. Yeah.
Wonderful. This leads me to my next question. How do you ensure anonymity through the platform?
Good. So essentially, nobody asks anyone of their name. So all engagements are de-identified. So at no time is your name asked. And more so, you are interacting via chat. So we don't even know your voice until you now willingly say that based on the nature of the engagement. For example, some people really ask some very worrying question that because we have trained the AI algorithm to be able to recognize some worrying situation. Somebody saying, "Oh, I'm bleeding." That's a very serious emergency. So the AI algorithm knows that anything bleeding, is a very, it requires an emergency. So if you are willing, then it asks, will you like to be referred to the nearest clinic or to be referred to a call center? It's only when you accept, then it's going to link you. And when you then go for that engagement, you are known by your ID, except you now say, "Oh, I want to mention my name." So largely the whole workflow is highly de-identified, is anonymous, and no individual can be linked, whether by your chat pattern or by your voice biometrics.
This is excellent. How do you track how effectively your platform is reaching its intended audience?
Okay, I think there are two ways to it. Like I said, is an integral part of a bigger program. So research, monitor, and evaluation is also taking place as well. Asking people who have used the platform to understand, their experience, to also understand the referral pattern, because we also have instances where users also refer people. So that allows us to monitor, and of course, even after the engagement is done, we also ask questions. How useful has the chatbot been in addressing your question? So you are also able to evaluate your experience as well. So that is what I call instant feedback. So we get that. In addition to that, we are also able to then do general monitor and evaluation, which is a standard learning methodology in programmatic intervention for development, where you randomly select samples of people and ask, how useful has the chatbot been to you? But because it's an integral part of a bigger program, it creates a sense of a continuum of service delivery, that those that are physically gone to see to a clinic, those that have gone to the website, those that have called the call center, can see the chatbot as complementary in delivering a continuum of health intervention as far as family planning, service delivery, customization is concerned.
So how do you get new users on your platform?
Largely, like I said, there is a programmatic event happening where our partner DKT, who are the field agent partner driving this whole program, they go from community to community, they go to campus to campus. So as part of the engagement, while they give general family planning information, contraceptive continuity and advisory services, they also refer the audience to a platform that, if there are other questions you have, you can just go to this Honey and Banana chatbot on your Telegram or WhatsApp and ask more personal questions and all of that. So that is the general approach being used. And then on the other digital channel owned by Honey and Banana, like I mentioned, that there's a website and there are a lot of social media channels as well. And then we've seen a lot of referral where previous users tell their friend, this tell your friend, member get member type thing, where people will feel this is really answering their personal question are always willing to tell their friend as well.
This is true, because I think I came across Honey and Banana on Instagram. I think there was a period where there were a lot of ads running, and I came across it and I was like, "Oh, I like that," because if you know me, you know that I really like anything concerning SRH. So yeah, I referred my friends to it. I haven't used it yet, but I trusted that it was fine. I don't know why, but it's okay. My next question, actually, you spoke about this earlier, but I would like you to just elaborate a little bit. So given that the platforms generally rely on internet or the use of the smartphone, how do you meander through that?
Well, to be very frank, because we are looking for very personalized, customized information, it is very important that it has to be internet powered, because it's going to interact with a dynamic AI learning engine, which will process information and then bring it to you. So at this stage, we deliver it through internet and smartphone. But there is a next phase, which is based on what we call just like an interactive voice response, which is an IVR, which is the next phase of the work, where I don't have internet, I don't have smartphones, I have what we call pasala phone, basic phones without internet. You just call in your local language. Then our AI engine will interpret what you have said as a text message. Then it uses the text message to engage the platform, and then it generates the answer. The answer is then voice, and then a call is initiated to you to read out like an interactive voice responder. I'm sure you recall that sometimes you want to know your credit, your airtime credit, and you call, and then it reads it out to you, or you just see it as a text. So we call it interactive voice response mechanism integrated with AI engine. So that's the next phase of the work, and we believe that that should be ready early next year so that we can make the platform more inclusive. People who cannot type, but they can speak their language, people who don't have smartphones, people who don't have internet, they can still access these services. The only thing is that there will be some lag time. It's not going to be dynamic. Yeah, there'll be some lag time because AI will be converted. No, voice will be converted to text, text back to voice, and then it comes to you. So maybe within like 15, 20 seconds, But of course, those processes are also getting faster.
I was going to say, not too bad.
Yeah. As AI begin to get better in learning and customizing experience, especially what we call localization of large language models, they become better, and services can also be better than.
Wonderful and excellent. I'm a very big fan of that. Also, as you said that you're hoping that it's going to be ready by early next year. I personally am looking forward to.
Thank you.
Like to use it.
Thank you.
So, what are some of the current or potential barriers you are seeing to accessing and using the platform?
I think the first today is the fact that you must have internet, you must have WhatsApp or Telegram. Whilst we believe those platforms are very pervasive, we still know that there are people who don't have those platforms. And of course, you have to use internet, especially because some responses will come as video. And when they come as video, you need to watch those videos. For example, how do I use a diaphragm, for example? You can't explain it. You have to show step by step. So in order to see that video, you must have data. And we know that everybody's very careful how much they are spending on the internet and all of that. But what we've done to address that is to make the video extremely data light. So videos that ordinarily maybe it might be like 50 megabytes, we make them as small as 1 megabyte without reducing quality. We use some compression technology to make it. But that is still a barrier, and we cannot take that for granted. The second one is the fact that whilst we believe everybody can type in their local languages, we also know that many people only speak their local languages, they are not able to type. I'm talking about Yoruba, Igbo, Hausa, and even Pidgin. They can just say, but they can't type. Even some can type English and not type their local languages. So whilst the platform is currently built as an interactive chattable platform, we also realize that that is a major gap. And that informs the need to make it voice-based, where I pick my phone, I just speak to it like I'm doing a voice note, and then I get a response. So those are the barriers we have seen. And maybe the third is the degree to which people are confident to talk to a virtual inanimate platform to give them very personal responses on their sexual and reproductive health. Generally, people I want to see somebody, I want to touch somebody, But to what degree do we believe that virtual channel can give us accurate and meaningful information? Of course, the information are accurate, they are valid, they are based on insight from thousands of experts delivered to you via an interactive channel. But from a behavioral mindset perspective and cultural mindset, were people able to trust such platforms rather than, I would rather want to see a nurse or a doctor, which may not be feasible, especially if you are very far away or you have an emergency and you need an instant answer. You need to interact, and instead of you going online and searching information that are not related to you at all, and you're trying to make through thousands of pages, and you get to see certain things that are not relevant or confusing and all of that. We have used AI or scary as well to make it relatable. The other point is the fact that the platform has also been trained on Nigerian languages and our nuances and our slangs. So we work with thousands of students across universities, both formal and informal youth, to collect all the terminologies they use. So when young people are talking about condom, there are over 15 languages used, terminologies that they can say to your presence and you don't know what they're talking about. Get me combo now, combo, for example. And some of those have regional flavors. When you get to Enugu, their name they use. You get to Calabar, their names. You get to Kano, their names that they use. So we work with a lot of young people to build those terminologies as well, so that our AI can learn when they use those terminologies. Whether it's collabo or whatever they use, or rubber, Tor, whatever that is, our AI system is able to understand those slangs, those ideoletical and sociological variations in our linguistic communication, and able to provide right answers to that.
Okay, so how is user feedback collected, and in what ways does it inform the platform's updates or improvements?
Yes, so I will start from the second question. Because it's an AI system, it keeps learning. So what are the most dominant questions people are asking? And then what are the follow-up questions? So somebody asks, if this happened, what should I do next? And what should I do next? So that allows us to understand conversational pathways, that is optimized. So that even before they ask, AI can then trigger. You just ask that, oh, what happens if someone is bleeding? And then I provide you an answer. And then AI says, are you the one bleeding? Because sometimes we are also projecting. We don't want to say it is ourselves. AI can sense that majority of the people in the last 1 month who ask questions in this way, this is what they actually meant. So then it uses that knowledge to optimize future conversation. So that is one thing we have successfully done. Learning from conversation pathway, key questions that people are asking, and then use that to optimize the engagement in a very proactive way, so that we almost we know what you're going to ask next, so we have the right answer for you. That's number one. Then number two is the fact that all the responses are cataloged in the backend and is available for intensive research. Like I mentioned, we're also working with Today University. Today University is one of the biggest centers of excellence for sexual and reproductive health research in the world. So they are also taking the data to understand patterns, insights that can drive program design, policy development, and further research in programmatic effectiveness, in new solutions that can drive contraceptive continuity, how to localize, personalized sexual and reproductive health interventions. So a lot of those data are powering new research areas for the academia as well, to be able to develop new models, new frameworks, new principles and pathways to make contraceptive continuity more personal, especially around the philosophy of client-centric counseling when it comes to sexual and reproductive health.
Love that. So you mentioned that the DKT team, they're the ones who go into the field. They want to go to campuses and stuff like that. So my next question is, are there any partnerships with schools that you're currently doing, and how do you expand your reach amongst your user base?
For us as an organization, we are not doing outreach, but to the best of our knowledge, DKT, who are and I'm sure you know that DKT is not just an advocacy platform, they are also direct to consumer sales organization. They also lead distribution of discounted sexual reproductive health products, which are also supported by Gates Foundation. Honey and Banana, Fiesta, and several brands of condom and other both male and female and other contraceptive support that are funded through the foundation are sold or distributed through DKT. So they have distribution channels, which include both physical outlets like hospitals, clinics, and institutions, universities, and all those networks of young people. And they use those channels to pass information, which would be the other channel that I mentioned is, of course, their social media platform as well, which is where young people go to. And then I'm aware that they are also using influencers as well, known names with credible, with credibility in health domains, who are also amplifying the conversation to drive usage and make it simpler for people to know that they need to know as far as their sexual and reproductive health.
I love that. Okay, so my final question. How do you measure the platform's impact on young people's knowledge, attitudes, or behaviors related to sexual and reproductive health?
Essentially, since it's about, at the end of the day, giving information to drive behavioral change. So there are a lot of series of post-intervention monitoring and evaluation, research that are done which allows us to engage people who have interacted with platform to ask them questions. Was there a change in behavior? Was there increase in trust? Because we've also realized that a lot of people are generally worried about asking questions on sexual and reproductive health and all of that. In certain crimes, asking about contraceptive could mean that you are promiscuous. So there are a lot of religious and cultural biases that exist. For that reason, we want to see that because you're able to engage a very personal counselor as it is, do you feel more confident about your sexual and reproductive health behavior? Do you feel that you got the right answers? And most importantly, was there a change in your behavior as a result of this engagement? So we're able to track that through structured research, both qualitative and quantitative. And the second layer is after you've interacted with the platform, the platform can ask direct questions, to ask you directly, how was the experience? Was it useful? What were the gaps? Are there things the platform could learn better? And we get that immediate feedback, basically. So largely, based on what we have seen the last 3-4 months, the result has been extremely positive. Indeed, behavior is being the desire for contraceptive continuity, access to family planning information is driving believability, trust, and desire for a better sexual and reproductive health behavior.
Beautiful. I look forward to engaging with the platform as well. Thank you so much for joining us, Dr. Bayo. I think that this has been an excellent discussion. I am very, very excited to keep watching what DKT does, what data science does, what Honey and Banana does moving forward. Do you have any final words, Pichu?
Well, great thanks to Gate Foundation for powering possibilities for exploring the use of technology to deepen and drive sexual and reproductive health. And kudos to our partners who have made this possible. Amazing team at Data Science in Nigeria. And of course, DKT and Tudor University based out of New Orleans in the United States, working together to do great stuff.
Thank you so much. And to everyone listening, thank you so much for joining us once again on the Break It Down podcast. My name is Asari. Keep listening, keep asking questions, and also please like, share, and subscribe. Thank you very much.